Good morning. This morning, we are going to have a wonderful interview with the CEO of SANAC, Dr. Thembi Xulu. I hope I've said that right, Thembi.
You
I
got
had a
that right,
friend,
Shereen.
I had a friend teach me how to pronounce it, and I'm quite passionate about pronouncing people's names properly, so I can do the
I'm proud of you. I'm proud of you. You've done
Oh,
well. You've done well.
thank you very much. Thank you very much. So, Doctor, you have a very important part to play in Rotary Family Health Days. But before we start with that, can you tell the broader public at large a little bit about SANAC, the work that you do, and the reach that you have?
All right. So thank you so much, Shereen, for having us today. As you said, my name is Thembi Xulu. I'm the Chief Executive Officer of the SANAC Trust. So the SANAC Trust is actually the body that has been selected by the SANAC Council. So the council is the bigger voluntary body which consists of government, civil society, private sector, development partners, labor, and all other stakeholders that have got an interest in the National Strategic Plan. It's chaired by the Deputy President, and it's the highest decision-making body in terms of HIV, TB, STI policy in the country. So we have got one national strategic plan, and my role as SANAC is essentially to make sure that I galvanize and move everyone towards the implementation of that one national strategic plan in terms of making sure that we test people for HIV, TB, and STIs, that we put enough people on treatment, that according to the goals of the NSP, which are 8, we reach our prevention targets, we reach our key populations, you know, sex workers, people who use drugs, you know, that we address social and structural drivers of TB and HIV, things like gender-based violence, that we mobilize sufficient resources, you know, for HIV, TB. You know, goal 8, for instance, is around the use of strategic information. So we need to understand the epidemic in order to inform the strategies that the country takes. But at the same time, goal 6 is on shared leadership and shared responsibility. That ultimately, it's not only health or the health department or government that can do everything where HIV, TB, STIs are concerned. It's a shared responsibility, and communities need not just take part or participate, but they need to lead the response if behaviors are going to stick. And we are learning that not just with HIV, but also with COVID, for instance. Wearing masks is a behavior that has to stick at community level. So yeah, so essentially my role is to make sure that United Nations is very clear that in order for a country to succeed in terms of an HIV program, there must be one coordinating body. In South Africa, there is SANAC. We must have one monitoring and evaluation framework, which I also lead. And there must be one plan, and that plan is the NSP, the National Strategic Plan. So yeah, that's what I do.
That is a huge scope of work. And I mean, you mentioned something which is mobilizing resource and not a simple process, because you talk about government and public-private partnerships, which leads us right into the arms of Rotary International. Can you tell us a little bit more about this partnership and what you envision for the future in terms of Rotary International and Rotary Family Health Days and the value that it adds to what it is that you need to do?
Okay, I think if I can be specific, especially with my being only a year old at SANAC, if you look at the theme for this World AIDS Day, for instance, it's working together towards ending inequalities, not only for HIV, TB, but for COVID-19. So it says, get tested, get vaccinated, and it says adhere to treatment. And if you look at the new global AIDS strategy, we are no longer just looking at what we call the 90-90-90 in terms of getting 90% tested, 90% on treatment, and 90% virally suppressed. We are moving towards 95-95-95, which means it's harder to reach populations that we haven't been able to get to through the usual channels, you know, of health facilities. Where the partnerships with the Rotaries is very exciting is that it allows us to provide a comprehensive package of services to the most remote communities that have got almost no access to services, you know, and those are the communities that we are looking for that last 5 to 10% in order for us to reach those services, you know. So we have these amazing family health days with the Rotaries. There's a multiplicity of partners, including government departments, you know, the private sector, communications partners like the SABC. And what we do is when we bring those services to the communities, we then activate the community to create, for instance, linkages, you know, to the nearest health facilities to ensure that there's continuity of those services. So what is exciting for me is the potential, you know, when you see somebody that struggles to get access to services, having a service brought to them in their community. And some of these communities are so remote that some of them, you know, when I look at the history of SANAC, as I said, I've been there for a year, it's communities that I've never heard of. Like this year's one is going to, I think it's a place in Pretoria West. It's called Boysens. The Boysens that I know is the one in the south of Joburg. But there's apparently a place called Boysens, and it's called Melusi Health, Melusi Health, I think it's a community health center in Boysens in Pretoria West. And when you hear the testimonies of people talking about how difficult it was for them to access services, and how for the first time they didn't even know that you could use 1 drop of blood to test not only for HIV, but for cholesterol and for blood sugar. And I've never ever had my blood pressure tested. You know, so it's really, really exciting to bring a whole comprehensive package of services to people that don't have access to services. And Rotary Health, Family Health Days, I think it's just one of the processes that we use to access the harder to reach populations.
That's amazing, Thembi. I mean, to get to people who are not easily accessible is one issue. I mean, the other burning issue that is really the theme for this year's Rotary Family Health Day is persons with disability. So talk to us a little bit about how that plays out in your world, because, you know, you face that challenge on a daily basis. One is that people are remote and they're out of town, so that's one challenge. But to add to that, even within those communities, are people who may be visually impaired, who cannot even get to something that is 1 or 2 kilometers away, or possibly is in a wheelchair, so they can't, you know, even a short distance can feel like a very long distance to them. And then obviously at the various medical centers where these free medical treatments are available, even in those centers, how that plays out with persons with disability. Tell us a little bit about that.
I think thanks for that, Shereen, because I think the good thing, especially with this this year's planning, was that it was planned with the SANAC disability sector's full involvement. So when I talk about SANAC civil society, there is 18 sectors that belong to civil society. One of them is the disability sector. And we were initially planning on having the Rotary Family Health Days in October, but we said the 5th of November is the day where the entire world, you know, actually commemorates or looks at the needs of people with disabilities, and hence the shift, for instance, to having it on this November day. So what's been good for me is that we have had input from the disability sector to say, for instance, a simple thing like you were saying, that having a ramp at a health facility doesn't necessarily cater for somebody who can't speak and needs a pharmacist that can explain what taking medication properly means. So that allows us to make sure that when we say we are taking care of the needs of key populations, we have a full understanding of what are the needs for people with disabilities. When we put together a package that responds to their needs, it's not us speaking to them, or us just sitting with them. It's them having a voice at the table, but also the whole thing of nothing for us without us. We might be policymakers, the deputy president, as I said, leads this, but when he sits at SANAC, he sits with all of us, including all the sectors, and the people with disabilities actually drive how they would like services to be delivered to them by making us understand what their needs are.
That's absolutely amazing. that it is taken into context. I actually interviewed Sandra Kamalo, who's a Paralympian. I don't know if you know her, a lady who has disability following a very serious car accident and was left paralyzed. And it was so interesting to exactly what you say this morning, Thembi, to hear it from her point of view, not for us to decide for them what they need, but for them to tell us what they need in the context of their disability, because there are so many different disabilities to consider.
Very,
So
very
tell me
true.
something. What does the future of SANAC look like? You newly appointed as the CEO, a year in your position. I was reading some wonderful information. You have a very impressive CV, I have to just tell you. But going forward, what does the future of SANAC look like? And what would you like to see more of with Rotary? And I'll tell you why I ask you that question. This video interview is going to be broadcast throughout the world with Rotary. As you know, there are 1.2 million Rotarians who are members of Rotary International, largely people from the business community on all continents who can really lean in and help, give a helping hand to Africa. Or if you are very specific about what the needs are, we can communicate that through this interview this morning. So what does the future look like, and how would you like Rotary to lean in going into the future in terms of the partnership?
Oh wow, that's a big one. I like the fact that you're asking me to dream, right?
Yes.
So a big one of the key things that I have focused on, Shereen, at SANAC, which is starting to take off, is strengthening strategic information and the use of strategic information to make sure that we understand the epidemic, that we are able to say, these are the interventions that work. These are the interventions that don't work. Therefore, we stop what doesn't and we expand what works. That requires us to essentially build what we call a situation room, which includes data sharing agreements, data being available, us having analytics, dashboards, for the whole country. And not just data on HIV, TB. I want to know about human rights violations, because if you look at Goal 5 of the NSP, the HIV and TB response is supposed to be grounded on human rights. So if there's anybody out there in the country that's collecting, human rights violations, information around people with HIV, TB, and how they are struggling to access services, that information must be able to feed into the situation room so that when I give the deputy president feedback, policies can be informed by the real picture of what is on the ground. So I think building that situation room, aligning that, for instance, with the upcoming national health insurance is one of the things that I think if we get right would be a big one for me. And you can imagine, the funding behind that is not small, but also the partnerships that are required to make it successful. We've got the new POPIA Act. We've got, issues that we need to respect around the confidentiality of data, so that making sure that data is aggregated, but at the same time that it's sufficient to inform the response. So one of my big dreams is to strengthen that Goal 8. Number 2, I think if you look at the 90, as I said, we might look as if we're doing well in terms of the first 90, we are testing people, but the second 90 is in the region of anything between 72 and 75%. In the region where we are going for World AIDS Day, the second 90 is at 67%. So the country, in terms of having deferred the development of the NSP, really needs to initiate more people on treatment. So that's what I'd love to do, but we need to maintain people on treatment to make sure that their viral load is suppressed, because once your viral load is suppressed, then your chances of transmitting HIV to another person are minimal, to almost zero, which is what we refer to as U equals U. And as I said, the Rotarians then become very, very, very important in that part because they allow us to get to those hard to reach populations. What I'd love to see with the partnership with Rotaries, I would say, is strengthening in terms of the partnerships that we have with other departments. The key principle, on the Rotary Family Health Days is Sue, obviously, as the president. I think her name is Sue, right? And then there's it would be the Minister of Health. But if you can imagine that we are reaching communities that don't get access to services, you can imagine, Shereen, if I can have the Department of Social Development addressing things like social grants, having home affairs there to look at things like IDs and birth certificates and whatever, so
Absolutely.
strengthening that. And then beyond that, because it's the start of a health service, making sure, as I said, that there's continuity, either through the mobile health services of the Department of Health, making sure that people continue to get screening if they were not able to get access to those 3 days, that they continue to get medication. We strengthen multi-month dispensing. If we can't be there every month, give people 6 months supply for a chronic condition so that they've got access to treatment. So it's things like that that I'd love to see strengthening and growing differently with the Rotaries. But as I said, from my end, on SANAC side, strategic information, reaching key populations, and another important key population, as I say, for me, is children. Children are the forgotten sector in the sense that we've done very well on preventing mother-to-child transmission. But when you look at the number of children that are HIV positive that are on treatment, it's very, very low. The pediatric formulations that are out there are not palatable, and you still have quite a high number of children not virally suppressed. And because of COVID-19, the picture with HIV and TB has gotten so worse that the number of people with TB in this country is extremely high. So we need to continue finding the missing cases in terms of TB, initiating people on TB treatment, and reducing the number of deaths that we are seeing from TB.
Absolutely. I get excited when I listen to what you say, because what you've been able to do this morning, Thembi, is take such a complex subject and make it very practical for Rotarians who will be watching this interview. And in terms of collecting data, the funding of those kinds of projects, we have leading champions around the world in Rotary with the most amazing professional skills, and getting this message out, I think, is critically important. So I'd like to first of all say thank you. Our 20 minutes has gone so quickly. I would love to interview you again. I think you are a wealth of information, and I'm excited about the future in your hands as the CEO. Congratulations on your appointment. It is wonderful to see a woman in leadership, and a woman who has influence with our government. And as Rotary, we partner with you faithfully. Thank you for your support. And we will see you at the soft launch on the 5th of November.
Thank you so much, Shereen. I look forward to meeting you too, and I look forward to an ongoing great partnership with the Rotaries. Thank you so
much, Doctor. Thank you.
All right then. Bye-bye.
Bye-bye.
Bye.